every healthcare organization is unique and different in how they treat BYOD. Some of them allow physicians, clinicians, and people to bring their devices in, and some don't. The ones that allow them to bring the devices in have strict rules in place and must have strict rules in place, because not only do we have the security issues that kind of run orthogonal to the need to have multiple devices, but we also have the compliance regulations.
Hi, I'm Joan Goodchild, Editor-in-Chief of CSO, and this is another edition of Security Sessions, where we talk to leaders in the security industry about important topic, issues, and trends that are important for CISOs and CSOs. Today we're with Ellen Derrico. She is the Senior Director of Healthcare and Life Sciences with RES. Welcome, Ellen.
Thank you, Joan. It's a pleasure to be here. As Joan mentioned, I'm Ellen Derrico with RES Software. We are the leader in the digital workplace, and we provide technology software solutions that enable IT service delivery to improve and help the clinicians get better access to the information they need, where they need it, when they need it, and securely.
Great. So we're going to be talking about healthcare, IT, and the security challenges around the industry today. Tell us just generally as we kick it off, what are some of the trends that you're seeing for security within healthcare? So
you might have been reading in the newspaper lately, the trends that we're seeing is a dramatic increase in ransomware attacks, malware attacks, and breaches in healthcare organizations. And many of these trends are increasing because phishing is increasing as well. And phishing is the way that many of these different attacks get into an organization. Somebody unknown to what they're getting in their email, or they get a malicious ad of some sort, will click on something they shouldn't click on, and then they get brought to a page, or they get brought to a section, and then all of a sudden they've got ransomware on their computer, or they've been infected by a virus that launches some kind of breach and theft of their information, and then they find themselves in a whole heap of trouble.
Right. Phishing tends to be still a very pervasive and troubling trend, I know, across many, many industries. But what about in healthcare? I mean, how is it different and challenging in healthcare, and how do you train physicians and other folks within the industry to be on guard for phishing when they're so busy, being focused on patient care?
That's exactly right. I mean, healthcare organizations are different than other organizations. Their primary focus is about improving quality of life and saving lives. And as a result, the clinicians, physicians, nurses, med techs, etc., are really focused on learning the newest medical information and medical technology so that they can better serve the patient population. And they're so busy serving patients because there's so many patients and there's such a demand for their time that they really are almost oblivious to phishing attacks and malware attacks. They just don't have time to focus on it. Their focus really needs to be on improving quality of care and improving that patient experience, and IT ends up sometimes being a disabler versus an enabler, and as a result they're a lot less focused on learning things around security for IT or being further distracted by IT. So they're very different than other organizations in that they're very singularly focused on improving patient care, and as they should be. So it makes it very challenging in IT to help educate them and give them the knowledge that they need around how to prevent one of these attacks.
So it sounds like security training is almost more annoying for folks in the healthcare industry as opposed to in other industries. How do you address that challenge, and how do you train people when they can find it to be really sort of a nuisance?
They do find it to be a nuisance, and the best thing that we've found is that organizations that are successful training their clinicians have found a way to make it very personal to the clinician, as well as being fun and entertaining and not so much of a distraction. So let me give you an example of what I'm talking about. One of our customers, UMC Health in Texas, in Lubbock, Texas, has had a very highly effective training program because they started teaching clinicians about security at home and doing it on the off hours and giving it as an optional course so that they could start exploring how security could be improved in their home lives and they could protect their own personal data. And they got so excited about that, they thought on their own that this should come to work. And as a result, they embraced and more openly were interested in learning about security. Then they ran some contests and did some gamification of the security training. So they had fishing competitions to see who got fished the least and then who got caught. And that made it kind of fun for them and less of a burden or a distraction. It was something they could do on their off hours that gave them personal benefit as well as professional benefit. And as a result, they were able to reduce their phishing attacks by 70%, and they were able to improve their security and their lockdown of their systems because people were paying attention to encryption and all sorts of other things they normally would never even talk about. So it was a really exciting case study.
And it sounds like the takeaway there was making it personal. That was kind of the secret sauce.
Personal and fun, and not security training, because they really don't want to have more training when they're focused so much on learning the medical things that they need to know to do their jobs.
Right, absolutely. So what are some other unique challenges to healthcare? I mean, we've talked a lot in the last several years too about BYOD and how various industries are embracing or not embracing it, or kind of stepping up to the challenge that bringing one's own device into the workspace has presented. What's BYOD really meant in the healthcare space for IT?
It's a great question, and it's meant a lot of different things. Every healthcare organization is unique and different in how they treat BYOD. Some of them allow physicians, clinicians, and people to bring their devices in, and some don't. The ones that allow them to bring the devices in have strict rules in place and must have strict rules in place, because not only do we have the security issues that kind of run orthogonal to the need to have multiple devices, but we also have the compliance regulations and who is allowed to see what data where and when, and to make sure that the person using the device is the person that they say they are. So there's a lot of need to make sure the profiles are accurate, that the person is identified on each device they use, whether they brought it in themselves or whether they're using a device that's been given to them. But the devices they bring in themselves need to really be in a secure environment. So giving up some of your freedom and rights is critically important in healthcare, that you're able to accept what the healthcare organizations put in place to secure those devices, and you follow the rules, that you're not using those devices to take pictures of a patient, for example, in a surgery, where that would be a violation of their HIPAA privacy rights. So it's a lot of unique and different challenges than you would have in another industry, given the security issues, but also the compliance regulations.
Right. Sounds like an awful lot of challenges that are very different. I want to go back to something we talked about earlier too. You mentioned ransomware, and we've been covering that so much on CSO lately too, of course. Hollywood Presbyterian Medical Center, they paid something like, what was it, $17,000 in a ransomware attack recently to be able to regain access to their networks. Why is ransomware so different in healthcare IT as opposed to, another type of organization being hit with a ransomware attack?
So in healthcare, it's life and death. And if a healthcare organization like Hollywood Presbyterian or any of the others that have been recently hit, and there have been quite a few in the news, if they get locked out of their system, if a clinician is locked out of their system, they are not able to actually get the patient information they need to treat the patient. So imagine an ICU setting, or the ED, the emergency department, or the operating room. Those are critical life and death situations for patients, and if all of a sudden the system goes down and that clinician that's treating that patient in one of those critical care facilities is unable to retrieve the patient record, they can't treat the patient because they don't know what they gave the patient, how long ago the patient was administered a drug or some kind of therapy or diagnostic. They don't know what kind of allergies that patient might have, or what might counterindicate with something they've been given. So they literally are stopped in their tracks, and patients will die in those situations if they can't get the access to the computer system. So it's really, really critically important that they have a backup plan and are able to provide access immediately to that physician so that that physician can treat that patient. And that's why ransomware is so scary. It's not about how much money it costs to get out of ransomware, it's how many lives are affected and how many patients are put at risk when a system goes down if there's no backup plan, or if they haven't checked vulnerabilities and prevented or done something with technology and education to prevent the actual attack from occurring.
And so where do you see this going? Are you hearing that more hospitals are in fact thinking about this now and getting those backup plans in place, or are we still at the point where more of them are really just paying the ransom?
I think you're seeing right now, at least I'm seeing right now, two camps on that. Some are just paying the ransom, but they also have to do some protection, because even in just paying the ransom, if they're shut down from the whole system for even a second, if a patient codes, there's nothing they can do. So they have to have some level of testing and visibility into their systems and some level of backup plan. But many are willing to just pay because it's not that expensive. It's a hit and run cottage industry where they come in on volume and they try to get as many people as they can, and they don't ask for a lot and they just keep going. But the scary part is if that ransom is not paid, within 2 to 3 days, those ransomware people are gone and they may never get their data back or get access to their data back. And so then they're really stuck in a place as a healthcare organization where they're unable to treat patients for a very long period of time. And it was over 11 days for Hollywood Presbyterian, unfortunately.
Yeah.
They had to divert patients to other places. It affected their reputation. Patients' health were affected. So it's really a scary situation when you think about it. It's different than breach where they can still operate.
Right, yeah, absolutely. A lot of risks, including, like you said, I mean, it can be life and death in some scenarios. So, well, great. Ellen Derrico, I want to thank you for being here with us today for Security Sessions. Ransomware and healthcare IT and security challenges is something we'll be continuing to follow in CSO. Check out CSO Online for more information about phishing, security awareness, and other important topics for CSOs. For now, I'm Joan Goodchild. Thanks for joining us and have a great day.